So in this video, we'll be assessing the abdomen. The first thing that you do when assessing the abdomen is, of course, inspect. So you inspect the contour of the abdomen, the symmetry of the abdomen, if there's any scars, sores, lesions, anything like that. If there's scars, it could indicate previous surgical interventions. And he does not have any. The stomach is flat, it is symmetrical, everything looks good. So the next thing you want to do is auscultate the bowel sounds before you palpate or do anything or even touch them, because that could give you a false bowel sound, and we do not want that. So the first thing we do, so the first quadrant that we're going to listen to is the right lower quadrant. And then the right upper quadrant. Then the left upper quadrant. And the left lower quadrant. Next, we're going to listen to the abdominal arteries. So the first one is the aortic. Next one is the renal. And then the iliac. And then the femoral. In there, you're listening to see if there's any bruise present, that swooshing sound, and he does not have any. Everything sounded good, and active bowel sounds. The next thing that we're going to do is palpate the abdomen. So the first palpation is going to be light palpation. In this one, you're just feeling the skin and feeling the musculature of the abdomen. The next palpation that you're going to do is deep palpation. And here we're feeling for any masses, that sort of thing. Any pain?
No.
Okay. And then we want to palpate the liver, and there's two techniques that you can use to palpate the liver. The first one is where you place a hand under the back, and then you find the rib cage and ask the patient to breathe in. Slide your fingers underneath, kind of move them around, and you can feel that round, smooth liver. Or the other one is where you kind of hook your fingers in and get the patient to breathe in. Hook your fingers underneath and feel, and you can feel that it's round and it's smooth and there's no issues. The next thing that we want to do is percussion. We want a general tympany all over the abdomen. We want a drum-like sound. It'll be dull if we're over any organs or any masses. So it was a general tympany all over the abdomen. Everything looked good, no pain, no tenderness. Everything seems to be doing well.